Hi everyone, this is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for tuning into my latest video. So, a very interesting case of a gentleman who travelled from Wakefield, Yorkshire. So it's around, I would say, 5 or 6 hour round journey. It came a few weeks ago. I've just not had time to upload the video. They were suffering from a blocked left ear, and they visited someone local to them in the first place who advised the patient that they had a double ear canal. So when the patient contacted us, automatically I assumed they've got a mastoid cavity. A mastoid cavity is when the mastoid bone behind your ear gets infected and it's surgically drilled out, and that causes an enlargement of the ear canal. And so when you look in an ear with a mastoid cavity, so if you're on my YouTube, you can, on my channel, you can do a search on mastoid, you'll see what I mean. The ear canal, it can be 3 or 4 times larger than what it should be, and that's because the bone's been drilled out, the infected bone, to prevent spread of this infection towards the skull. And so that's what I was expecting, but when the patient attended, you can see the ear canal, it just looks like a normal ear canal in terms of anatomy. What they've got is all this dead skin, dried otter ear. So otter ear is like a discharge pus, and it's kind of crystallized all over the ear canal. So the patient is suffering from otitis externa. Otitis externa is an infection and or inflammation of the outer ear canal and the outermost layer of the eardrum. The eardrum's got 3 membranes. The outermost membrane is formed of the same skin that lines the inner 2/3 of the ear canal. So that's stratified squamous, keratinous, epithelial layer of skin. And when that's infected, we call that otitis externa. So otitis means ear infection, externa is the external outer ear. Otitis media, for example, would be otitis, so infection media of the middle ear, so the cavity behind the eardrum. And the patient was also advised when they saw, when they were assessed recently elsewhere, that just to use drops, and they've been using olive oil drops for 2 months now. And so they are a YouTube subscriber. I think they also follow me on Facebook, so I'm sure they'll be watching this. So it's a very complex procedure in the sense where there's no plug of wax to remove. We're just trying to remove all this dead skin, crystallized otter ear, so crusted ear discharge basically, off the ear canal. Now, it's very difficult because the outer third of the ear canal is cartilaginous, so we can apply some pressure like we are here. But when you get to the inner 2/3 of the ear canal, it's very sensitive. When we train our clear wax delegates, I always make reference to that game of Operation. You may have played it, where you've got different parts of the body, different objects, so different bones, different parts of the body, and you've got some tweezers, and you've got to remove it without touching the side of, for example, if you're removing the femur from the leg, there's this electrical sensor, so if you make contact with it, the buzzer comes on. So you need a very steady hand when we do this. And at the moment, I'm just using a standard Zollner suction probe. Now, we're approaching the bony part of the ear canal, so here I'm just being extremely cautious. And it's a very tedious procedure. Now, when we remove the dead skin, discharge, it does give some patients some short-term relief. However, they are still suffering from otitis externa. Suctioning the ear doesn't get rid of any bacterial fungi which is causing this. We're just cleaning the ear. So post-procedure, I advise the patient to use acetic acid, so ear calm spray, and if that wasn't successful, to contact ourselves, so we can write to the GP, so the GP can prescribe something else, something like Optimize. So ear calm spray in the UK, it's an over-the-counter spray and it's acetic acid. When you develop otitis externa, the pH of the ear canal changes from an acidic pH, which is what it should be. If I remember correctly, it should be, I think around 5.7 to 6.3 pH level. Don't quote me on that, but it's roughly there. Probably be a bit lower actually. And when you've got otitis externa, studies have found that the pH changes from an acidic to an alkaline pH, so above 7. So the idea of acetic acid is to reacidify the ear, and that's an over-the-counter spray. If you go to the GP, they can also prescribe something in the UK called Optimize. So Optimize contains 3 active ingredients. Not only does it contain acetic acid to reacidify the ear, It also contains steroid dexamethasone, which has become quite a well-known steroid because of its treatment in COVID. So it's an anti-inflammatory steroid. And it also contains an aminoglycoside, does Otomide. So an aminoglycoside is a group of antibiotics which are generally used for ear infections, but they can also use for chest infections. It's called neomycin, this particular one in Otomide. Now, what neomycin does, it doesn't actually kill the bacteria per se, it inhibits the bacterial growth. So one of the things, and I'm sorry for getting a bit sciencey and medically, but it's just I've got a lot of subscribers who are junior medics or audiologists like myself, so and quite often we do get emails thanking us for such explanation, so obviously hence why I'm explaining it. So neomycin, how it works. So in the cell of the bacteria, you have different components. So you have the nucleus, you have a ribosome. So the function of the ribosome is to collect amino acids and put them in order to create proteins based on the DNA code. So a ribosome has two parts, and what the neomycin does, it attaches itself to the subunit, the smaller part of the ribosome, which goes around collecting amino acids, bringing it to the larger part. And so it locks itself into the subunit. So the ribosome of the bacterial cell is unable to produce the proteins to replicate itself. So that's what neomycin does, just in case you're interested. So Otomide has a few more ingredients. It's not only contains acetic acid, it also contains an anti-inflammatory, and it also inhibits bacterial growth through the neomycin. So with the neomycin aminoglycoside, aminoglycosides are known as ototoxic. So if they do enter the middle ear, so if the patient had a perforation and it enters the middle ear and then the inner ear, it can actually cause permanent deafness. So they're typically only prescribed in instances where the patient's eardrum is intact, as in this occasion. Now, the patient did advise that they've been using a lot of water. They try to self-DIY. They're using over-the-counter bulb syringe. Strongly not recommended. I mean, during the pandemic, when we were closed, there's very little else people could do. So worst case scenario, I mean, what else can you do if you're suffering from a blocked ear and everyone's closed? It's kind of the only real option. But generally, we want to avoid water in the ear. And I have to stress this to the patient. They're a bit surprised when I mentioned that not to use water in the ear. Water's bad for the ears. So I always compare it to kryptonite and Superman. So you really want to stay away from it when it comes to the ear. So you always got to protect your ear. I've had so many patients who have been suffering from chronic ear infections, and after I told them to avoid water in the ear, they come back for their general earwax removal, but the ear canal health is so much better. So they're being very cautious when they're going swimming or in the bath and making sure they're wearing ear protection, preventing water in the ear. Now, sorry I haven't talked much about the procedure because it is almost self-explanatory. All I'm doing is suctioning this debris off the eardrum using a fine end gauge. You can, and at the end, if you stay tuned and watch it at the end of the video, I'm going to replay the beginning of the ear so you can see a pre-procedure, and then you'll see the finish art. You can see the difference. And it is a very tedious procedure. I'm just thinking about some of the clearwax delegates we train. Would I expect them to do this in the first instance? No, because it is quite complex. You're making contact directly with the eardrum, and also we're trying to remove all this debris off the bony part of the ear canal. So it is a very tedious procedure. Again, just using a fine end, just going in, just suctioning around. So majority of the eardrum is now visible. The patient did call back after using the ear calm. They still felt blocked. So we obviously advised we wrote to the GP, so look, this is what because GPs in the first instance would recommend ear calm in any case. That's because we want to be careful about GPs, doctors, medical professional. You want to be careful about bacterial resistance through medication. So because Otomide contains an antibiotic as well, an aminoglycoside, we can, if you overuse those and prescribe them unnecessarily, you can develop resistance to that. So ear calm was probably the best bet in the first instance, for sure. So again, just near the entrance here, just some dry skin. I did put some drops in there, I had to because it's too crusty, it was blocking the tube as well, so just to loosen it. And obviously we suctioned all this, the dampness out as well. And already it just looks so much better, so much clearer. I had another instance, I'm just on my YouTube channel here, I'm just trying to find the procedure if I can. Let's have a look. Of a similar instance where I had a patient who attended, not with any blockage. The ear canals were completely, you can see the eardrum, but they just had dead dry skin. And I think they travelled from Wales or from Glamorgan, if I remember. And I believe it's episode 752 if you're interested. So the name of the video, if you're on my YouTube or even on Facebook, it's 752. The video name is Delicate Complex Skin Peel. And it's just and the patient, they left some reviews on the YouTube channel on the video and just explaining how much of a difference it made. I was always a bit skeptical. I said, well, there's no occlusion, there's no blockage, it's just dry skin in the ear canal now. Is it best treating with medication, which is the norm? Or is there any point me trying to suction it, because we could sometimes make things worse if we cut into the ear canal wall, because we are moving stuff off the ear canal wall, especially the bony part. We're now exposing the canal wall to infection because it's obviously exposed, it's cut, it's open. But the more I'm doing these procedures, I do with the patient. Maybe it's placebo, I'm not sure, but I don't think it is. I think patients really do have it may only be short-term benefit because, as I said, this otitis externa is still present. So until they get this treated, this condition it could be in a few months. They present again with the same condition. The ear canal's all got discharged dead skin coating the ear canal wall and the eardrum. So it's just a bit left anteriorly on the eardrum. Can just about squeeze the fine end in there. So we'll be really delicate here. So we want to avoid the canal wall to the left, but they've got the malleus, the hammer bone, which is coming out. You can see there the eardrum slightly moving, just trying to get it into that gap. The patient, this is all done under no anaesthesia. Patient's awake, comfortable throughout. Some of you may be wondering, why don't you just flush it out? No, with using an irrigation or syringe method. When you've got we don't, in the UK, syringing and irrigation, it's GPs, doctors, so just stop performing that completely now, more or less. The gold standard here is suction, so there's more inherent risks. With irrigation, you're more likely to develop tinnitus, infection, and also when you've got an infection already, you do not irrigate the ear, you're just going to make it worse. So this is a pre-video. This is how the patient came in with. You can just see that. You can barely see the eardrum. It's all this gunk lining the ear canal wall. And after 10 minutes with myself, or it was a bit longer actually, in a minute you'll see the post-video. You can just see it's all glazed over. It's very hard to visualise the eardrum. So this is post-procedure. To see the difference there. You're never going to get every little last speck out because you'll be there forever, but just see the difference there.